Medical advances are bringing new hope to patients and families living with Alzheimer's disease, which affects nearly 7 million Americans, two-thirds of them women. Eli Lilly and Company is working to change the trajectory of Alzheimer's by educating on the signs and symptoms of the disease, the importance of a timely and accurate diagnosis, and developing potential treatment options. Now, joining us today is Dr. Julie Schwartzbard, a neurologist who specializes in Alzheimer's disease research and treatment, and to tell us more about advances in identifying and treating this disease. I noticed she smiled when I said her last name. Did I say it right?
You did fine. Thank you.
Okay. So, doctor, what should people know about Alzheimer's disease, especially the early symptomatic stages?
Sure. There's about 4.5 million people in this country with early Alzheimer's disease, and only half of them have come to diagnosis. And there's many reasons for that. One is, how do you identify these patients? How do you distinguish them from somebody who just has normal aging with perhaps a senior moment here or there? A couple of clues are the consistency. So, for example, if somebody is consistently repeating themselves, consistently forgetting recent conversations, if they're regularly forgetting appointments or misplacing personal items, that consistency is a red flag, and really suggests a person should go to the doctor for an evaluation. Alzheimer's disease is caused by abnormal proteins in the brain. And those proteins, the earliest protein is called beta amyloid. And beta amyloid can accumulate in the brain, causes these clumpy plaques. And it's the amyloid plaques that is thought to cause the symptoms of early Alzheimer's disease. It's interesting to know that these plaques can deposit upwards of 10 to 20 years even before somebody is expressing symptoms.
Why is it important to recognize the signs and symptoms of early symptomatic Alzheimer's disease?
Well, there's a bunch of reasons, but most importantly is safety. Once we can make a diagnosis, then we understand that this patient is going to need monitoring, right? Is mom driving safely, and is dad taking his medications properly? So we want to manage expectations, and that really can best be done once the diagnosis is made. Also, this is a pretty exciting time in Alzheimer's research. We now have medications coming to market that can potentially slow down the course of the disease. Generally, these are medications that are attacking amyloid, so they drag amyloid out of the brain. And these medications work best when given to patients early on. So the earlier a patient can be diagnosed, the earlier they can be offered one of these medications that may in turn slow down the progression of their disease. I should mention that all medications have potential side effects, and this class of medications is no different. And so when considering one of these newer medications, it's very important to go through the potential risk and benefit both with your doctor and your family.
Now, what barriers are preventing some patients from receiving a diagnosis?
Well, one of the barriers is kind of a peculiar one, and that's the patient themselves. It's very common in Alzheimer's disease for a person to not recognize they're losing their memory. They lose insight, so they lose this ability to realize that they're forgetful. And so they're not going to go to the doctor on their own. It takes those around them, their loved ones, to recognize the problem and make sure that they get in to see a doctor. And then, of course, there's structural barriers, getting the appointment to see the doctor, getting an appointment to see the right specialist, making plans to get the diagnostic testing performed. All of these are potential barriers which can make making the diagnosis more difficult.
What role do diagnostics and treatments play in this disease?
Well, years ago, not very much, right? But things are changing both on the treatment end and on the diagnostic end. So we now have something called an amyloid PET scan. That's a specialized scan of the brain that can light up the presence of beta amyloid, this abnormal protein. And that's one way to make the diagnosis. Alternatively, patients can undergo a cerebrospinal fluid analysis, a lumbar puncture, used to call that a spinal tap, and that can give us the same information. We even now have blood tests. The blood test is not confirmatory. It's considered a screening test. But if someone does undergo blood screening and it's positive, then they're indicated to move forward with more specific diagnostic testing.
So, where can family and friends go for more information?
Well, certainly go to your doctor and make sure that you let them know if you have any concerns or if you have any concerns for a family member. I also think that the Alzheimer's Association has lots of wonderful resources. Their website is alz.org, alz.org, and there's all kinds of information on that website.
Doctor, thank you so much for joining us and talking about this. And then we noticed when I said friends and family members, yeah, I have someone I need to talk to, definitely. Thank you again for joining us on Morning
I,
Blend.
I encourage you to do so. Thank you very much.
Thank you.